So telehealth services have been around for decades. However, there's been increasing value in delivering care to our patients using telehealth, especially during the COVID-19 pandemic. Cardiologists are able to check in with their heart failure patients, pediatricians are able to connect with children and their families, and geriatricians are able to speak with the elderly. And this really helps prevent patients from leaving their home and allows them to prevent their risk of infection. The patient reaches out to the office to schedule a telehealth visit. If the patient wants to use their laptop or desktop, they only need a webcam. If they want to use a phone or a tablet, they will download the AW Touchpoint application in advance of their encounter. The provider will then send either an email link or a text message. The patient clicks the link and then they're invited to our virtual waiting room, and then they connect with their provider. All patients, whether tech savvy or not, are absolutely having no issues engaging in the platform. Because a physical exam is limited, it gives me as a provider the opportunity to really answer all the questions that a patient may have related to any of their pre-existing medical concerns, any concerns that they have in the state of the current healthcare climate. I enjoy being able to engage with the patient, interview them. A lot of times they'll have family members who are located with them who they want dialed into the call as well, so we have that opportunity with our telehealth platform. Thousands of Northwell providers have recently been enrolled in the telehealth platform and are able to perform telehealth visits. Now, some providers are not available, so it's best to call the office to confirm, but if your provider is available, you could absolutely schedule a telehealth visit and receive this care from the comfort of your own home. I've really enjoyed the opportunity of engaging with my patients. It's a wonderful way to offer a personal touch without the physical touch. I'm able to practice continuity of care, keep my patients outside of the emergency rooms and urgent cares when not necessary. COVID-19 has certainly changed the way that we think, we work, and many other aspects of our daily life. And the opportunity to allow patients to receive care without having to leave the comfort of their own home and potentially invite caregivers who are not located with the patient into the encounter is extremely valuable. Initially, a lot of patients might seem a little reluctant, and some providers were reluctant because this is new, but all of the patients and all of the providers that I've been in contact with have absolutely found it a very simple process. It's very easy to engage with your patients through this process, and patients are extremely gratified that, especially at a healthcare climate that we're living in now, have the opportunity to engage with their provider. I can absolutely imagine that in a non-coronavirus world, telehealth being so useful.